We saw a lot of different things. We started in wards, we went to A&E and theatres.
Yesterday, when we were shadowing ward consultants, there was a specialised consultant in diabetes. That was interesting.
So I'm Alison, I go to Catholic High School and I was on the medical placement. What that involved is I got to go on wards, into A&E and also into theatre.
My favourite part of the work experience was when we were in A&E. It was really interesting, it was very busy, but it was very interesting to see the vast variety of people you get in A&E, the different ages, different demographics, also the vast multitude of reasons why they were in, from everything from maybe small breaks up to...
So my expectations beforehand is I thought I'd just be sort of sitting in a ward, maybe I might see a doctor come in and stuff like that, but it'd probably just be more ward based, I wouldn't have much experience, and I was actually, me and both Eve, who was also in the work experience, were very impressed at how many different placements we got. We were in several different wards and different areas in A&E and theatres, and sort of how hands-on it was. After doing the work experience, it's really affirmed that I do definitely want to do medicine. I definitely want to be a doctor. Specifically A&E was amazing, I loved it. Came home, told my parents I wanted to do A&E, they all told me I was crazy, but it was great. So that's definitely reaffirmed that we definitely want to do medicine, and hopefully for universities and stuff like this, it's given me something to talk about, to show my passion about medicine.
So hi, I'm Eva.
I'm Rosie.
I'm Charlie.
And I'm Molly.
And we did the dental work experience. So over the past few days, I was lucky to observe a dentist's day-to-day life. I observed many student dentists.
So my name's Eva Bannerman and I was doing the dentistry course this week. I think that actually the reality exceeded the expectation, because I didn't expect to see as much as I'd seen. I kind of hoped that I would get to wander around the dental clinic, but I actually got to see and experience the students explain operations that they actually did. So I got to see a couple of teeth getting pulled out, a root canal, and I also wandered down to the dental therapy unit, where I got to see how the dental therapist actually interacted with the patients and how much dentistry and teeth can affect your mental health as well. I was swithering with dentistry before I came in, that's why I signed up with the course, but this has definitely solidified my choice to be a dentist, so very good.
After the circles are done, they will open their mouth and scrub forwards and backwards on all teeth.
So my name's Charlie, I'm 16 and I was working in the Child Smile Oral Health Improvement Team area. It's definitely influenced my thoughts. I'd love to be part of the Child Smile team, they're just such a great bunch.
I'm Eva Graham. I was working within the mental health support worker at the Kaleidoscope and also at the employability service.
The employability service offers different activities such as art and creative writing, which I had to get involved in.
It was definitely a positive experience. It's one that was very valuable, and the people you meet through it, like there's people that will stick with me for the rest of my life. I definitely want to do psychology at uni, and it means it's definitely solidified that as well, which is really good.
Hello everyone, so we are the Recruitment and Workforce Sustainability Group, and here's a little bit.
It's a really great afternoon this afternoon, hearing the experiences that our young people have had across so many different services.
And we did the leadership and management placement.
Hi, I'm Ashley, and this week I did my placement in occupational health and safety.
For our work experience, we were with the clinical education team.
The discharge of patients is a much bigger job than what I thought. You need to make sure the patient has a way of getting home.
And what really came through was about the teamwork and how every role within health and social care matters so much.
Hi, I'm Molly and I was doing the community nursing. Hello, I'm Brooke. I was placed in Thornhill and I was doing the community nursing with the local.
Hello, we are the group who are working in the support services.
We were set to be in the emergency department in the Galloway Community Hospital.
However, we got an even better experience as we shadowed and visited many different departments within the hospital.
For people with dementia, as we always have to be occupied all the time.
The nurses were definitely very, very welcoming to give us some more understanding, and I've got to say a big thank you to.
In the morning we were at the pathology and histology department or microbiology, then in the afternoon we were at biochemistry or haematology and blood transfusion.
So during our time in the microbiology lab, we were given a case study and we identified that the patient had bacterial meningitis. To do this, we looked at the number of neutrophil and lymphocyte cells in his CSF sample.
Yeah, I'm not gonna lie, it was not as different as this. Like, there were cardboard boxes. There were so many boxes in those things. I don't even know what those are for.
And taking this course, I've learned so much over the past 2 days, and I've decided to go for midwifery.
We were shown how the pharmacists and pharmacist technicians talk to the patients to figure out what types of medication they take and to decide whether it's safe to prescribe certain drugs.
I think they really got a very deep insight into what's on offer in healthcare in general, but going into each individual section that those were working in. In the couple of days they spent, they got an awful lot out of it, so I'm really impressed by that. Healthcare at the moment is a difficult area, there's a lot of challenges, but we need young people coming through with ideas and energy to bring some sort of fresh perspective on things, and I think I got a lot of that today.
It's been a fantastic afternoon this afternoon, listening to the young people and hearing about their experiences working across a whole wide spectrum of roles across health and social care. Hopefully they've all taken something positive from their experiences and started to cement their thoughts about working in health and social care in the future. And we certainly within the Health and Social Care Partnership will want to build on this and take forward similar programmes to this in years to come.
To hear the students say that it cemented their decision to continue or pursue. But more than that, we've seen our services stop and think about how they promote themselves to others. It's just been an amazing day. It's been an amazing week. Thank you.